Assalamualaikum to Madam Akila. I hope Madam is always in good health. My name is Akila Akmal Abdul Halim. My metric number is 270632. I will introduce about our poster while other friends will talk about point of poster. In the poster, we put all information that will be needed by participants who will follow this program, such as information about time and date of the program. Next, this program open to whom and where the program takes place. To further strengthen, we use the slogan #Stay Home, Stay Safe to invite everyone to stay home and doing practice health care. Secondly, why we choose this title? We choose this title because it is similar to the situation that we are facing right now. People must live in new norm, which is more to do practice healthcare at home to avoid corona infection out there. We opinion think the healthcare must come from home first. Then we can free from corona symptom. This is because there are only our family members at home. Therefore, it's easy for us to do healthcare at home. We do not have to be crowded with people that we do know where they come from, because this can put us at risk. We hope we created this poster will attract people to do practice healthcare at home. Don't worry, there are many ways to take care your health at home. It is nutrition, exercise, cleaning, painting, don't touch our face, and lastly, avoid people. All these tips are very helpful for our healthcare at home, and I hope this can be useful for everyone. Thank you. One of the information to be conveyed through this poster is to encourage everyone to take care healthy food during COVID-19. Before that, many people did their daily life by eating out. So, with the new norm, let's eat together at home with family, cook and eat nutrition food. Firstly, healthy care with nutrition. Healthy food will be healthy for our bodies. Before that, what is mean by food nutrition? Nutrition is process of nutrition by living organism processing food for grow the tissue for the body tissue human. So nutrition food is very important for healthy care. Secondly, why healthcare must go through food during COVID-19? New norm was teach us to frequently eat healthy food, because before this we always take so many fast food, and sometimes it gives us disadvantage. So for that, parents can monitor of nutrition for their children and their self. Example, we often hear that COVID-19 virus has potential to attack people with high blood pressure, heart disease, and the elderly. So the benefit here by eating nutrition food can give some person body metabolism increase and be healthy. Thirdly, when we cooking together with family at home, we no need to hand out to buy food outside. With hot weather temperature, we cause a person to expressing headache and lead to fever. This can give someone energy help and lead to infection. So I recommend for everyone cook and eat at home. With that, besides that, we know what the ingredient that we use to cooking, and firstly, our body can be helped, and our food will more quality, and we can healthy. So, before that, the interesting, we can eat together with family, with comfortable. Previously, prepare homemade food. Someone must have busy daily life to prepare food at home. However, with the new norm, we should cook and eat healthy food at home. Many healthy and delicious recipe can be found online. So everyone, don't worry. We can practice to make a meal nutrition for family. Therefore, we do not have to go out and gather in public to buy food outside. It can lower the risk for us in COVID-19 infection. Before that, not only is the family healthy by eating nutrition food, but it also stay away from COVID-19 infection. Last but not least, I hope everyone will apply by eating nutrition food at home. It is some of practical care that we can do. So many advantage we can get. So let's eating nutrition food. Healthy family, avoid from COVID-19. That's all from me. Thank you.
Assalamualaikum and hi to Madam Azlida Arifins and all my friends. I will explain about the planting. First of all, I will talk about the benefits of plantings. First is to fill the free time during the pandemic COVID-19. Always the day, we usually do the outdoor activity such as going to work in office for the lecturer and going to the college for the student for study and so on lah. But when the country is hit by the virus pandemic COVID-19, so our movement is limited due the quarantine times. Planting is the example and simple activity can do at home. So planting is an activity that can be complete at this time, and it can also reduce stress and provide good healthy for our body. Another advantage is to stay healthy while getting the fresh crop. By planting, we will get lucrative result in terms of the freshness of the crop we produce compared to the vegetable brought from the market. We mostly use the pesticides. Besides that, we also get own certifications from the work done. The work have done. In addition, we can also take advantage to the empty space on the yard that can be bush. Even using the space available will make the page more neat and beautiful. Pandemic COVID-19 also give us the opportunity to tidy up the yard compare the before time because we are busy with outdoor works and so on lah. Besides that, we can also save the cost of buying goods when shopping in the market. With the worsening economic situation during the COVID-19 disaster, we should be frugal in managing finance. Besides, planting can also be an interesting hobby. For example, growing vegetable and ornamental plants can be lucrative source of income and hobbies. Okay, let's talk about the words don't touch. It is a method where these tips can prevent from being infected with this dangerous virus. For example, avoid touching the face when the hand are dirty or holding areas that are frequently touched by others. Furthermore, we are also advised to always practice this maximum hygiene by always washing hands with soap or hand sanitizer. This can keep ourselves always clean and safe from infections. So for all, let us make the most of our time with the beneficial things and always practice the best hygiene ethic. That's all from me. Thank you.
Hello and Assalamualaikum. My name is Zalia Binti Zulfikri. My metric number is 273520. Okay, today I'm going to present to you the importance of staying active at home during COVID. As many of our daily routines remain restricted during the coronavirus pandemic, it can be difficult to find the motivation to exercise. With the challenges of working from home and limited access to fitness facilities, we may be finding it hard to stick to a workout routine. You may be missing the environment of the gym, the relaxation of swimming laps, or the social connection from walking or hiking with a group of friends. If you were used to attending a fitness class with a motivating instructor, you might be disappointed in the intensity of workouts on your own. Maintaining an exercise routine at home can seem more like a chore than a want to at the moment. And with so many people out of work and struggling financially, staying active can seem like much less of priority. However, even activity can make a huge difference to how well you think and feel. In fact, exercise is one of the most powerful tools we have for staying physically and mentally healthy. Exercise can also strengthen our immune system, something that is particularly important at this time, especially for older adults who are more vulnerable to COVID-19. That is the main purpose of for exercise. Okay, the second one is the benefit of exercise for our health due to this pandemic. Okay, exercise can help to ease depression, stress, and anxiety, and aid in the management of chronic conditions such as high blood pressure and diabetes. Okay, by finding new ways to get moving and stay motivated, you can take charge of your mood and well-being and regain a sense of control during this time of great uncertainty. Okay. Consider your energy levels. Many people report fatigue from coronavirus related stress. Any ongoing health concerns and the time you have available, then set reasonable goals focusing on activities you enjoy. You're more likely to stick to an exercise plan if you start small, celebrate your successes, and build up gradually. Okay, for example, keep your workouts interesting. Watch your favorite streaming show or listen to a podcast or some great music. Okay. While working out, walking, explore a new area in your neighborhood, or catch up with a friend on the phone to keep things from getting stale, or try to do any activity, video games or exit games that simulate dancing, skateboarding, soccer, bowling or tennis. This can be great alternative if you're unable to participate in the real thing at the moment. The next is people should practice to cleaning or washing all their every surfaces in their house to avoid disinfections or anything. The importance of cleaning around the home is cleaning and disinfecting high touch surfaces in your home regularly is an important precaution to lower the risk of infection. Um, you can follow cleaning product instructions for safe and effective use, including precautions you should take when applying the product, such as wearing gloves and making sure you have good ventilation. Some national authorities have made lists of recommended products for use against the COVID-19 virus. Okay. Next is how to disinfect. It's important not to wipe cleaning solutions off as soon as you have applied to a surface. Many disinfectant products, such as wipes and sprays, need to stay wet on a surface for several minutes in order to be effective. Always read the directions to make sure you are using the products as recommended, and to avoid damaging sensitive items such as mobile phones and other electronic devices. Consider using wipeable covers for electronics. Lastly is wash your clothes and wash yourself after back from anywhere. It is currently unclear how long the COVID-19 virus can survive on the fabric, but many items of clothing have plastic and metal elements on which it might live for a few hours to several days. Exercise caution and common sense. Good practices to consider include removing your shoes when you enter your home and changing into clean clothes when you return home after being in a crowded places, and washing your hands with soap and water immediately afterwards. Okay, that's all from me. Thank you.
Hi, Assalamualaikum and good morning. So my name is Asyikin Binti Mohammad Manan and my metric number is 273538. So today I'm gonna to share with you guys about how to practice healthcare at home during this COVID-19. So my point is avoid from people. How to avoid spreading coronavirus to people you live with? Okay, the first step, if you have symptoms, you should stay away from other people you live with as much as possible. As a responsible person, when we know we have a symptom, so the first step that we must to take is quarantine ourselves for 14 days. This 14 days quarantine period is determined by the Ministry of Healthcare to determine whether we are infected with the virus or not. So, if we are infected with the virus corona, we need to do the next phase, such as quarantine in the hospital, and what we need to do is just listening to Fraulein advice carefully. Okay? If you can avoid it, stay on your own in one room as much as possible and keep the door closed. And then avoid using shared space such as the kitchen at the same time as other people. And then you can eat your meal in your room. Is this because the virus can spread to release fast in communication? And then talking at close range without wearing a mask also can speed up the spread of the virus through close range communication. Then use a separate bedroom, otherwise use the bedroom after everyone else and clean it each time you use it. For example, by wiping the surface you have touched. Then avoid sharing personal items. Do not share dishes, cup, glasses, silverware, towel, bedding or electronic such as cell phone with the person who is sick. It's especially important to try to avoid spreading the infection to anyone who are at higher risk from coronavirus, such as people who are 70 or over, pregnant, or have a weakened immune system. If you live with someone at higher risk, try to arrange for them to stay with friends or another family while you are self-isolating. If you have to stay at home together, try to keep 2 meters, like 3 steps away from each other. If possible, try not to share a bed. In conclusion, there are 6 ways for us to practice healthcare at home during these COVID seasons. There are examples such as nutrition care, exercise, washing and clean, planting, don't touch anything and also avoid people. All these methods has been well explained to you all. If you are caring for someone with COVID-19 at home or in a non-healthcare setting, follow this advice to protect yourself and others. So, we need to learn what to do when someone has symptoms of COVID-19 or when someone has been diagnosed with the virus. This information also should be followed when caring for people who have been tested positive but are not showing symptoms. So, let us all practice this healthcare. It is in a new norms to ensure that safety and security in our country. Okay, that's all from our group. Bye!